Hello, and welcome to the Acid-Base Physiology Review course component of the Falcon Physician Review Online. My name is Sunil Udani, and I will be serving as your instructor through the Acid-Base Physiology Review. In the Acid-Base Physiology Review, we will start with a few general principles, then moving on to the clinical manifestations as well as the clinical approach to acid-base disorder. In Section 1, we will review general principles of acid-base chemistry and acid-base physiology. Hello, and welcome to the acid-base physiology component of Falcon Physician Online Review. My name is Sunil Udani, and I will be serving as your instructor for this portion. In this portion, we will walk through basic acid-base physiology, as well as clinical applications, and the approach to the patient with acid-base disorders. In Section 1, we will outline general principles of acid-base physiology. Before we talk about acid-base physiology, we should first review the concept of pH. pH is determined by the concentration of hydrogen in a solution. The pH is equal to the negative log of the concentration of hydrogen. pH and hydrogen concentration have an inverse relationship, where the higher the hydrogen concentration, the lower the pH, and the lower the hydrogen concentration, the higher the pH. In the human body, the normal range of pH ranges from 7.35 to 7.45. In general, a range between 6.9 and 7.6 are considered to be compatible with life. At pHs below that range, at pHs outside this range, normal physiology is disturbed and death quickly ensues. The plasma hydrogen concentration is approximately 40 nanomolar. This is in the normal range and corresponds to a pH of 7.4. Right now we should make the distinction between acidemia and acidosis and alkalemia and alkalosis. Acidemia and alkalemia reflect the pH of the blood measured. Acidosis and alkalosis refer to processes. A process that decreases body pH or increases free hydrogen concentration leads to acidemia is called an acidosis, whereas a process that increases pH, decreasing plasma hydrogen concentration, is called an alkalosis. An alkalosis will then lead to alkalemia. Important to note that the hydrogen concentration normally in the blood is approximately 1,000,000-fold lower than the normal concentration of the other serum electrolytes. Specifically, if you recall, the plasma sodium concentration in the normal range is 140 millimolar. The plasma chloride concentration is approximately 100 millimolar, where the plasma hydrogen concentration is 40 nanomolar. This is why, even with very small increases in plasma hydrogen concentration, it has very profound effects on body pH. Body pH and plasma hydrogen concentration need to be tightly regulated because normal enzymatic function occurs best within a fixed range of pH. Further, hydrogen ions are small and highly reactive. They can quickly bind to negative charges on proteins, leading to denaturation and inactivation of essential enzymatic function. The major effects of acidemia are as follows. You'll notice that acidemia has effects on the cardiovascular, respiratory, as well as the other major systems of the body. The major cardiovascular effects of acidemia are impaired cardiac contractility, arteriolar dilatation, venoconstriction, and centralization of blood volume. Acidemia also leads to reduced cardiac output and renal blood flow. Importantly, at severe ranges of a low pH, the body has decreased cardiovascular responsiveness to catecholamines. Clinically, this becomes evident in shock states, where often acidemia is in existence concomitant with the state of shock. In those states, the normal catecholamine response is less effective due to the body pH. The respiratory effects of acidemia are primarily driven by the body's attempt to compensate for an acidemia. Specifically, the respiratory center is stimulated to increase respiratory rate and increase ventilation. Hyperventilation occurs as well as the sensation of dyspnea. However, counteracting this attempt, there is decreased strength of the respiratory muscles. There are important metabolic effects of acidemia as well. Hyperkalemia, due to impaired activity of the sodium-potassium ATPase, is often seen in the setting of low pH. There's also increased metabolic demands. However, there's inhibition of anaerobic glycolysis and reduced ATP synthesis. Therefore, supply-demand mismatch is common with regard to energy in the setting of acidemia. The CNS effects of acidemia include impaired cell volume regulation, and at extreme levels, decreased levels of consciousness leading to obtundation and coma. Alkalemia is, however, no better than acidemia in terms of the systemic effects. The cardiovascular effects are also dangerous, including arteriolar constriction, reduced coronary blood flow, and reduced anginal threshold, as well as a predisposition to arrhythmias. The respiratory effect of alkalemia is also a compensatory mechanism. There is decrease in ventilation. Usually this has the effect of increasing carbon dioxide concentration to ameliorate the alkalemia. However, this can lead to hypoxemia as well. Hypokalemia and reduced plasma ionized calcium concentration are the major metabolic effects of alkalemia. There are also effects in the central nervous system, including reduced cerebral blood flow. Also, tetany, seizures, and extreme forms, lethargy, delirium, and stupor can occur in the setting of alkalemia. While acidemia is often clinically encountered and considered bad, alkalemia is no better and often will serve in the same deleterious effect on normal physiology. Alkalemia, just like acidemia, can lead to rapid deterioration of physiology and eventual death. What mechanisms are in place to maintain plasma hydrogen at nearly constant levels? There are three major mechanisms of hydrogen regulation. The most immediate is in the setting of changes in acid concentration is the use of buffers. The next most immediate response to changes in hydrogen concentration is through changes in minute ventilation by changes in pulmonary function in the lungs. And finally, changes in hydrogen concentration lead to changes in the kidney handling of hydrogen ion, changes in net acid excretion. Buffers play an extremely important role in the maintenance of normal body pH. The buffers allow the body to tolerate small excesses or deficiencies of acid without a significant change in plasma or cellular pH, while the other mechanisms in the lung and the kidney are in progress or are at work to return hydrogen concentration and pH back to the normal range. Just a brief review of weak acids and bases, as it will have an application when we discuss buffers. A strong acid, such as hydrochloric acid, completely dissociates into hydrogen and chloride when added to water. A weak acid, however, only partially dissociates into hydrogen and its conjugate base. Weak acids in the range of physiologic pH make ideal buffers, as they allow for small hydrogen concentrations of minimal change in total body pH. Weak acids serve as buffers in normal human physiology. Weak acids can dissociate into an anion, which serves as the conjugate base, as well as a hydrogen ion, the conjugate acid. This allows small changes in the concentration of either to have minimal effect on pH. Just to briefly review, the acid dissociation constant for a given reaction is defined as the Ka, which is equal to the concentration of hydrogen times the concentration of the conjugate base over the concentration of the weak acid. A substance works best as a buffer at a pH in which the conjugate base is an equimolar concentration to the weak acid. This is where the concentration of the anion over the concentration of the weak acid is equal to 1. The pH at which this occurs is termed the buffer's pKa, or the negative log of the Ka. The important buffers in the human body have a pKa near the normal pH of blood. Let's walk through in a little more detail how buffers work. Addition of a small amount of hydrogen will cause a left shift of the reaction outlined above. The added hydrogen will combine with the conjugate base and will produce the original weak acid. The net result will be a small change in the actual concentration of hydrogen ion. Similarly, the addition of a small amount of alkali, the anion, will combine with hydrogen and form the weak acid. Once again, there will be a little change in the free concentration of hydrogen. Certainly, if a large amount of acid or base is added, then the buffer is consumed and the pH will change. Once again, it's important to remember, since the hydrogen concentration normally is very low, and just small changes in hydrogen concentration thus have a very strong effect on body pH, the body does its best to make sure that there are only minimal changes in hydrogen concentration. It does this first with the use of the natural buffers. Before we move forward into acid-base physiology, we should review the Henderson-Hasselbalch equation. This is another form of the dissociation constant equation, and it relates the pH to the concentration of a weak acid and its conjugate base. It is derived down below, but the important thing to remember is that the pH is equal to the pKa plus the log of the concentration of the anion over the weak acid. This equation allows one to predict the change in pH as bicarbonate or the weak acid concentration changes. Many buffering systems are important in physiology: plasma proteins, hemoglobin, phosphates. We will focus primarily on the bicarbonate system because of its regulation in the renal physiology as well as in the pulmonary physiology. The bicarbonate system exists as a specific type of buffer, as well as serving as an example of a weak acid-base pair. This is the full equation outlined as follows. Carbon dioxide, which normally exists in the gaseous form, is also in equilibrium with the aqueous form. Carbon dioxide combines with water to form carbonic acid. Carbonic acid is a weak acid and dissociates into free hydrogen concentration and bicarbonate. Due to the prevailing equilibrium and the activity of carbonic anhydrase, this simplifies to carbon dioxide dissolved in blood, or the aqueous component, plus water equilibrates to free hydrogen concentration and free bicarbonate. Using this equation and the previous Henderson-Hasselbalch equation, we can predict how changes in bicarbonate concentration or changes in carbon dioxide concentration will affect pH. Using the pKa of this reaction, we substitute the numbers and we see that the pH of a given solution, in this case blood, is 6.1 plus the log of the ratio of the bicarbonate concentration over the 0.03 times the partial pressure of carbon dioxide. The 0.03 is to calculate the aqueous form of carbon dioxide. The equation itself is not important to remember for the purposes of the Step 1 exam, but the concept is extremely important. This is how pH can be predicted based on knowledge of the concentrations of any of these components. As we have said, regulation of pH occurs by three mechanisms. Immediately, there is buffering, which is essentially an instantaneous chemical reaction that modulates small changes in hydrogen concentration so that they have very little effect on pH. There is also a rapid adjustment of alveolar ventilation to either remove carbon dioxide or retain carbon dioxide, depending on whether acidemia or alkalemia predominates. Finally, the kidneys regulate hydrogen ion and bicarbonate ion concentration, but this takes longer, more in the setting of hours to days, before the final result occurs. These three systems in concert maintain plasma pH at the normal range in normal physiology. This concludes Section 1 of the acid-base physiology review. The key fact to remember from Section 1 is that in normal physiologic state, the hydrogen ion concentration in the body is 1/1,000,000th fold lower than the concentration of other important ions. Thus, small changes in hydrogen ion concentration can have large effects on pH and body function. This is why the body has developed different systems, including buffers, changes in minute ventilation, as well as renal regulation of bicarbonate reabsorption or excretion to maintain hydrogen concentration and pH within a fixed range. In Section 2, we'll provide an overview of how the system handles an acid load.